Hello, everyone. I am Dr. Maura Quinlan. I am a practicing OBGYN and the Women's Health Medical Advisor for the Illinois Department of Public Health. And importantly, since October is Breast Cancer Awareness Month, I am a wife and a mom of 3 young adult kids, and I have been getting annual mammograms since age 40, some number of years ago. I have had those scary moments of having an abnormal mammogram and being called back for a biopsy. I understand the relief of getting good news and knowing that the mammography screening worked to make sure that I didn't have an early breast cancer. I have a friend who recently had breast cancer discovered on her routine yearly mammogram. But thanks to that early detection and treatment, she is now cancer-free. It's scary to think what she might have had to go through if she had not had gotten her mammogram. We have all heard the statistics. Breast cancer is the leading cause of cancer deaths among women aged 20 to 59. 1 in 8 women in the US will be diagnosed with breast cancer in their lifetime, and every 2 minutes, a woman is diagnosed with breast cancer in this country. So in the time I am speaking with you, 2 women were diagnosed with breast cancer. There are 2.9 million breast cancer survivors in the US. Risk factors for breast cancer include older age, a family history of breast or ovarian cancer, and having dense breasts. And let's talk about dense breasts for a minute. A person is diagnosed with dense breasts because it is seen on their mammogram, and it's seen in half of women over 40. And this density can make it harder for small cancers to show up on mammogram. So if your mammogram results show that you have dense breasts, talk with your healthcare provider about your risk factors and whether you may need additional breast cancer screening. So some of these risk factors you can't change. You can't change as you're getting older. You can't change your family history or the density of your breasts. But there are some risk factors for breast cancer you can control, like being physically active with a healthy weight and limiting the amount of alcohol you drink. You may think that you don't need a mammogram if you don't have a family history of breast cancer, but at least 90% of breast cancers in the US have no genetic link. So remember, you still need breast cancer screening with mammograms even if you don't have a family history. Early detection is essential to being able to get the most effective treatment options and increase your chance of survival, since women with early breast cancer usually have no symptoms. In fact, a mammogram can detect cancer years before you or your healthcare provider can feel a lump. If breast cancer is diagnosed in the early stages with mammogram, 99% of women will survive at least 5 years. But if the breast cancer is diagnosed in later invasive stages, only 23% will be alive in 5 years. Breast cancer is not the same for everyone. While white women have a slightly higher rate of breast cancer diagnosis, Black women are more likely to die from the disease. And unfortunately, 47% of women with insurance age 40 and older are not getting their mammograms every year, a number higher for women who don't have health insurance. The great news, though, is that increased awareness and early detection through regular screening have put breast cancer deaths on the decline. It's important to stress again that breast cancer screening with mammography can detect cancer early when it is the most treatable. If you are a woman over 40, talk with your healthcare provider about scheduling your annual mammogram today. If you are a woman of any age who is at high risk for developing breast cancer, talk to your doctor about when you should start getting your annual mammogram and ask about genetic screening and other ways to reduce your risk of developing breast cancer. And if you are worried about cost, the Illinois Breast and Cervical Cancer Program offers free mammograms, breast exams, pelvic exams, and Pap tests to eligible women. You can find a provider near you by calling the IDPH, so Illinois Department of Public Health, Women's Health Line at 1-888-522-1282, or a little easier, and I've tried this myself, if you Google IDPH, so Illinois Department of Public Health, Google IDPH mammogram, you will get to the site with more information. So early detection of breast cancer can save your life. So please call today and make an appointment for your mammogram. Do it for yourself, do it for your family. Be well and have a great October.